Hi, I'm Tom Eschen, the host of this Power and Politics podcast, a conversation about the issues that are impacting New Yorkers the most with the people that are making those decisions and holding them accountable along the way, too. Today, we sit down with Dr. James McDonald, the New York State Commissioner of Health, and we get his first thoughts as we go into a new presidential administration after the first of the year about what the state will do as we continue to have new policies potentially from that Trump administration. His thoughts on the vaccine, fluoride in water, some of those bigger issues, and along with chronic disease and how they want to combat that, and maybe in confluence with the federal government at the same time. We speak about some of these issues impacting New Yorkers, specifically CDPAP and that transition from the fiscal intermediaries, which there were more than 700, to just one, and how that process is playing out and the timeline of that process along the way. We speak about opioids as well, the opioid settlement funding, where that money is going and why. Master plan for the aging, something that's coming out in early January, something a lot of people are looking for to see what some of those recommendations will be to protect New York's elderly. Thanks so much for watching and listening. As always, you can always subscribe wherever you get your Power and Politics podcasts, and also you can watch on YouTube at CBS 6 Albany. Dr. McDonald, thank you so much for coming on with us today. We really appreciate your time.
Oh, glad to be here. Thanks for inviting me.
So let's start with new presidential administration's coming in January. How does that impact the state health department like ours?
Yeah, we're paying close attention to the federal transition. I mean, one thing to be really clear, though, is the mission of the New York State Department of Health, that doesn't change, right? Our mission, protect and promote the health and well-being for all, built on a foundation of health equity, that mission doesn't change. So, and by the way, we're a pretty big health department, pretty big state. You know, we know what we're doing, and we're going to keep doing our work. Having said that, of course we're paying attention to the federal transition. If you're asking me, have I read Project 2025, the health section? You bet I have, and I've had the team read it as well. I want to see what are the ideas that are coming forward a little bit. So we're studying what is in Project 2025. We're also listening to what's going on out there, and we're kind of getting ready for what could be coming down the pike.
How do you feel about what you read? How does that align with your beliefs as someone that's been in this for a long time?
You know, I think there's a couple things that make me just pause a little bit. One is the vaccine world, right? Like, I'm an old pediatrician. I know I don't look old, but I'm an old pediatrician. I've been around a long time, almost 35 years. We have the safest and most effective vaccines we've ever had. It concerns me when I hear this narrative, really just with no evidence, questioning their safety. That just concerns me. But keep in mind, states regulate who gets a vaccine. By the way, it does concern me about the fluoride conversation. You know, we've been fluoridating water in the United States for 75 plus years. And the dose is 0.7 milligrams per liter. It's not a lot of fluoride, by the way, that I need to give you to help protect your teeth. And, you know, 0.7 milligrams per liter, that's kind of an abstract number to most people, but think about 3 drops in a 55-gallon drum. But the dose of fluoride in the United States, it's regulated. Our water systems are monitored. So, you know, I think this is one of those things where fluoride's really good at protecting our teeth. You know that old expression, apple a day keeps the doctor away? Mm-hmm. Really hard to do that without healthy teeth. You really need that dentist to help you, but you really need the community water fluoridation to protect our teeth. Keep in mind, I want people to eat a healthy diet. That's one of the things I do like what I'm hearing about. I love the conversation about a healthy diet, you know, because by the way, the New York State Department of Health, we've never told you to eat processed food. We've never told you to drink sugary beverages. Mm-hmm. Well, we have told you to eat real food, fruits, vegetables, nuts, lean meats. One of the things that I'm interested, though, and I think this is where it'd be nice to work with the federal government, like, hey, the federal funding for the Women, Infants, and Children's program, that's been pretty flat for a long time. I'd like a little help there. And oh, by the way, you know, if we want to get real foods to everybody in the United States, there's a lot of food deserts in the United States. Food deserts are places I can't find fruits and vegetables. Some are in New York, but all of the United States. But if the federal government wants to partner with us to help how we get, you know, how do we get real foods to real people? I'd love that. Because we think about, you know, Tom, why is food processed at all? It's processed to make the food more affordable, more palatable, and transportable. It's not processed to make it more nutritious. There's nothing better than real foods for you. You know, real foods, nutrient dense, processed foods, calorie dense. I want that apple a day, the strawberry a day, you know, those broccoli a day too, by the way. For those who don't love broccoli, warm up to it. It's really not as bad as you might have heard.
Yeah, you got to cook it the right way, right?
You got to cook it.
If you want to cook it.
Throw a little garlic salt on it if you must.
Yeah.
You know what I mean? But broccoli, I think it's been criticized more than it should be.
So let's get to the fluoride aspect of this conversation. I want to talk to you about the vaccine too. Should a municipality be able to vote on that? Should there be a sweeping mandate across the state, or should like an individual place be able to choose, a group of residents be able to vote on whether or not they have fluoride in their water?
Yeah, well, right now in New York State, like most other places in the United States, it's a local decision.
Yeah.
It really probably should be a local decision because they're the ones who control their water. And I don't really have a problem with that. You know, in the majority of New York, a little over 2/3, roughly 70%, has community fluoridation. It's a great thing. I'd like to see it more widespread. You know, it just helps more people. You know, one of the things we have to own a little bit is we don't have great access to dental care, not just New York, but anywhere in the United States. You know, most people aren't getting to the dentist twice a year. We have data that shows, you know, adults on Medicaid are only getting to a dentist 30%, you know, once a year. That's not where we need to be. You know, kids in particular, we're not seeing great access to dental care there as well. If we give up community water fluoridation, we run the risks of more cavities and more poor oral health. Oral health is really important for your physical health, you know, not just for kids, but for those of us as adults.
Let's get to the vaccine portion of this conversation. I know that RFK Jr. has sort of made it sound like it's a decision that someone needs to be able to make on their own. I guess however you want to be able to take that is what it is. Should there be more access and I guess more palatable education about vaccines to help people understand exactly what the science is behind it, to help educate people more about this? Because I think you mentioned some of these claims have been made with no evidence or a different kind of science, whatever you want to call it. Should there be more, I guess, a more palatable way for people to understand what's going on here?
I think so. You know, I think one of the things we have to own a little bit is misinformation spreads like wildfire. You know, the whole issue of vaccines causing autism has been super well studied, not just in the United States, but all over the planet. There's no evidence vaccines cause autism. And, you know, I'm a dad with 3 kids. 2 of my kids have different forms of autism. Of course, my kids got their vaccines, and no, their autism didn't come from vaccines. There's genetic links to some of this, and sometimes we just don't know. But really, one of the things I think about with the general public is the general public is inundated with misinformation all day long. And when you get bombarded with those things every day long, some of that seeps in a little bit. And one of the things I think we all need to own a little bit is who's influencing you, right? Because really one of the things I want you to ask as a human being is who's influencing you? Because I think if we really ask that question, we get to an honest answer is a lot of us are being influenced by a nameless algorithm that we give unlimited access to our minds. Why did we give up that individual autonomy so quickly? Why are we letting algorithms, whether it's from social media or elsewhere, deciding what news we read or what social media we consume? And to some degree, this gets back to like, I want you to be careful what you put in your body with your food. I want you to be careful what you put in your mind, by the way, as well.
Now, there's a mental health aspect to that, of course, at the same time.
It's a mental health aspect, and also it gets to a relationship aspect, too. Yeah. Like when you think about how we interact with each other, isn't it interesting how the concepts we get from the algorithm are influencing how we relate to each other over politics and other things? When it's like, you know, I'm an old man. I know I keep getting to that point there, but I remember when we just didn't have this, we had to talk to each other. We had to be polite to each other. There's inhibitions that we give up on the phone, on social media, that maybe we should put back in, you know? Always being polite, always being respectful of other people. That's one of the things I learned as a kid. Always be respectful, even if you don't agree.
I did want to ask you one more thing about RFK Jr. I actually got to sit down with him a few months ago when he was still running for president. He talked a lot about chronic disease. Like, what do you make of some of the things he said about the rise of that since his uncle's administration and any of the factors that could be tied to that and what the health department can do about that?
Yeah, so I think when you talk about chronic disease, it's nice to separate out, like, it's a multifactorial cause. But one of the things we need to look at as Americans is obesity in the United States. We're a nation that struggles with obesity. A lot of that has to do with our lifestyle, though, right? Like, we become much more sedentary. And by the way, when you're not moving, you're not burning as many calories. The other issue that I think we have to really own is what do we put in our bodies? And this really gets the food choices and gets that point earlier, like processed food, calorie dense. Real foods, nutrient dense. Your body needs nutrient. Now, I'm not saying if we eliminate the obesity epidemic, we solve every chronic disease, but it's part of the conversation. By the way, making sure our air quality is really good, that's really important to me because asthma is a chronic disease too. But I know if you're around clean air, that's one thing I can do to help you, right? But when we look at the climate, which has changed, that's another space where that's only going to make chronic disease worse. And I think these are just a couple things where I am looking forward to working with whoever will help me on this, right? Because when I think about for the New York State Department of Health, I want you to be healthy. I don't want you to have a chronic disease.
I think it's interesting, and we've had this conversation in the newsroom before about there's some aspects, there's some things that you align with the potential new administration proposals on, and there's some things you clearly don't. I guess, how do you balance that at the end of the day? Because I think a lot of people are saying, yeah, we need to have healthier food. This processed food probably isn't good enough for people to be able to have. But then they might think differently on vaccines. How do you balance some of those ideals? And can you make that work? I guess you probably think you can at the end of the day. To take some and leave the other, I guess.
That's exactly right. Like I'll throw this out to you. Like, I'm a pediatrician at heart. I'm also board certified in preventive medicine. But as a pediatrician, I've learned to work with anybody over the years. And how you manage it is I'll always go back to my mission. As long as what's being proposed on a federal level marries up with the mission of the New York State Department of Health, I'm all on board. If you want to protect and promote the health and well-being for all built on a foundation of health equity, your idea is welcome. On the stuff, though, that is not going to help protect and promote the health and well-being for all, we're going to have problems with that. And that's where in New York we can squish what we can squish. New York's a big state. We have a lot of influence. We can protect you during this time.
Yeah, that leads me to the next question about something that the Speaker, Mike Johnson, said a few days ago about Planned Parenthood and defunding that. How do you react to that as a State Department of Health, from I guess if you lose that federal funding?
Yeah, so, reproductive rights, really important to the governor, really important to the Department of Health, really important to me. So that's obviously a priority of ours. But I think this gets to really the larger issues that you hear in the current administration. Why do they feel the need to control people so much? We're a nation that was built on freedom. People deserve freedom. When it comes to people who are going to give birth, choosing to protect their own health and having the freedom to make their own choices, I think we need to just own that people should have the freedom to make their own choices. People don't like to be controlled. And one of the things I worry is when you say things like that, what you're really saying is you want to control us. Americans don't like to be controlled, don't deserve to be controlled.
Is there something you can do to counter that lack of federal funding for Planned Parenthood?
Well, there is. Keep in mind, New York put $25 million a year towards making sure we expanded reproductive rights in New York State. Yeah. And we've actually let people come in from out of New York State to have their reproductive health care needs met. And we do that, and we're very, very proud to do that. And this is one of those things where, the governor is very committed to this. The governor is very committed to protecting the health and safety of every New Yorker. I'm never confused about her larger mission there. So New York has a lot of resources. We're a big state. We'll do what big states do, and we'll protect our people.
All right, let's move to more of a state issue, and that's CDPAP. And I know, there's been campaigns. I'm sure you've seen the commercials. Interview I did with the PPL executive director, their CEO, has been playing on one of their commercials. This conversation around this transition, I'm curious, do you think, in the lawsuits also in mind, is it going to impact the timeline of this rollout? I know the governor just said the other day that her office told one of the publications it's still April 2025. Is that still the date with all this in mind, with lawsuits, legislature pushback, public pushback? Where are we here?
Yeah, so just as far as the Department of Health's role in this, what we're doing is we're enacting and implementing this law. Yeah. Yes, it is still on time for April 2025. The people who work at the Department of Health are very committed to getting this delivered on time. There's a lot of people working very hard to make sure the transition is smooth. Just so people hear this from me, if you're someone who receives consumer-directed personal assistant care services, you shouldn't see a change with this. Your services should stay the same. Your workers should stay the same. This should stay the same for you. That's our goal. That's what we're planning on doing. When you really think about what happened, all we did is went from 700 or plus middlemen to one, who then hired 24 subcontractors. Just so we have frame of reference here, we had more of these fiscal intermediaries, more of these middlemen than every other state in the United States combined. And really all we're trying to do is organize it and try to deliver as premium a product as we can. It's very important to me and the governor that we protect the people who are getting services, and that's what we're hoping to do.
Are you concerned about, I know that, of course, this company does have some past issues that were many years ago, but are you concerned about anyone losing care, losing wages, depending on who they are?
Well,
in this transition,
we're committed to protecting that. We're committed to making sure people still get the services that they're entitled to, and we're committed to the workers really not noticing a transition. Our expectation is this transition occurs seamlessly and it goes along well.
Let's move on to opioids now, and I know that you've done a lot of work in that in your career, and now, of course, on the advisory board at that. What are some, from you, I guess you can speak to your own role in this. I know you're on the board, right? You're a part of this group of almost 24 people at this point. I've seen, of course, the allocations of this funding. For you, what is the most important pot to put the funding in to help this mitigate this crisis?
Yeah, if there was one big pot to put it in, we would have done it a long time ago. And I think this really gets to the issue is that it's a complex problem, but it needs multiple solutions. So you're absolutely right. People need safe places to live. People need really good access to sound treatment. By the way, we need to have really good access to naloxone. But by the way, people need employment opportunities. And there's a lot of reasons why the money is going in all different resources, because there isn't one solution that solves everyone's problem. One of the things I think back to, though, is that New York, like a lot of other states, we've come a long way. We're actually starting to see progress in this space. We're seeing significant decreases now in overdose deaths. It's encouraging. There's a lot of work more to be done, let's be sure. But when you think about the adversary, the potent fentanyl we're dealing with, the fact that we're making progress is really encouraging to me.
You added, I believe the board added some areas of funding, right? It's in the last November?
Yeah, and I think those are really important measures to take here. One of the things we have to just keep in mind, though, no quick fixes, comprehensive solutions. And I love the community engagement. I love the stakeholders being involved. We're hearing from a lot of the people who understand this on a boots on ground level, really important.
Harm reduction gets more money than anything. It's about 28%. Everything else is about 14 and under. So you could say it's about double what the rest of those pots get, if you were to keep on calling it that, or I guess use that word. But why is that such a point of emphasis?
I think the thing about harm reduction, and just to make sure we have the same understanding there, harm reduction is one of those things we're recognizing not everybody is ready for treatment right this minute. And that's just the nature of any chronic disease, by the way. But we know what people are ready for is strategies they can do to keep themselves going until they are ready for treatment, right? So part of why harm reduction is so critical is recognizing you've got to meet people where they are. And the reality of it is, when you have a dependence on opioids, it is a powerful dependence. It's a terrible disease. When someone's dependent on opioids, this is more important than their family relationships, more important than their work relationships, more important than anything else. Helping that person to get to recovery takes an enormous amount of commitment and time, and it takes more than one try, usually. It's a real important journey. Part of this is signaling the state's commitment. We aren't giving up on you. We're committed to you. We want to help you get to recovery, because once people get to recovery and sustain recovery, beautiful things happen. I've personally known many people who've been at the depths of this disease, found recovery, earned the recovery, maintained the recovery, living their best life, happy without substances, fully employed, restored family relationships. It's a beautiful thing.
Theory behind the harm reduction is that it's a point of contact, right? It's to be able to keep somebody alive, which is what I spoke to sheriffs about and law enforcement, and said, well, at the end of the day, you're keeping them alive longer to be able to maybe give them a pamphlet, right? That's sort of the point of that.
One way I think about it is there's a window of willingness for people to earn a treatment. Sometimes the window's barely open. But if that window's got a bare crack, and at that moment we can get in and offer you, for example, telehealth, where we get you on buprenorphine, in other words, through Matters program, one of our telehealth providers in New York State, that'd be great. Because once we get you started on buprenorphine and you feel like the withdrawal is gone, because withdrawal is awful, once we get you out of withdrawal and all of a sudden your head starts clearing up a little bit and the cravings start going away, this is the wonderful thing about buprenorphine. It really does help people find that path to recovery. It's a great tool to add to everything else we do to help you find your recovery and maintain your recovery.
So with this emphasis on harm reduction, why not expand the ability, expand what people can use for those antidotes? You have naloxone, and I know there's been pushes for other antidotes to be able to use. That OPV, I believe, is the one that I think there's been legislation about. Why not expand beyond naloxone at this point?
Well, so what I'm interested in...
Which people know is Narcan, I guess.
Narcan, right. So, one, it's about safety, right? Like, by the way, when I do a standing order, it makes a drug over the counter to you. My concern about OPV or nalmefene is the long half-life. It's 10.5 hours. And by the way, with that, it takes 5 half-lives to clear any drug. So that person staying in withdrawal for 48 hours, they won't do that. They're going to use again. There's the reason why myself, national experts are coming out saying this is not appropriate. In other words, just reading an article yesterday saying there is no role for this drug. Right now, it's not better than naloxone. One of the things I've done, I've met with the company, and my team has met with the company 3 times now. We've asked the same question 3 times. Show us the field data that shows that people actually respond to nalmefene and don't go into a situation where things get worse, because that's what we're worried about, right? And we aren't getting that information. They said they would send us the name of 3 doctors or their clinical experts. They sent to us 2. One person said, I've never prescribed it. The other person never got back to us. Not helpful. I ran into them last week and I gave some talk at a conference. I said, look, we're just looking for data. They know what we're looking for, but the data isn't there. And I'm reading more and more national articles really partnering with New York, no, but just saying the same thing what New York is saying, which is right now, naloxone's safest and most effective. There isn't a rational argument. And this is one of the things where you really have to be careful about what we give to the public. We don't want to cause harm. I'm the state's doctor. I want to protect you. I don't want to put you in harm's way.
So one more about opioids is the stewardship fund. I've spoken to some lawmakers who are asking where that money's going, if that money is, maybe thinking maybe it should be moved out the door quicker. What is the situation with that right now? Because that is in the hands of the administration, right, at this point? That's not for the legislature to dole out that money.
Yeah, so the money will go out. And actually, New York's done a pretty good job of getting the money out. We're a little bit better than most other states in that regard. Keep in mind, it's state money. We're wise stewards of state money, so it doesn't go out willy-nilly. We have to pay attention to it. But New York's done a pretty good job of getting the money out the door. And keep in mind, we're going to be doing this for a long time. It's about getting it right.
Yeah. Let's go on to the master plan for the aging. I've spoken with some advocates in that aspect of things, asking for it, looking for it, very specific areas they want investment in. What is the status of that right now?
Well, the master plan for aging is coming along. It's due in early 2025. Yep. We expect an on-time delivery.
Okay. Isn't there a report or a recent draft has that come out yet? Is that supposed to be out? I think there was one supposed to be before 2025. That was a preview.
There's been some reports. I'm not sure if you're talking about one that's missing, because there's been interim reports.
Yeah.
But really, the final product's going to be delivered in early 2025, and I expect it to be delivered on time.
What do you want that to address?
Really, I think when you think about the master plan for aging, I'd go back to one of the governor's top priorities. How do you make New York more affordable? How do you make it affordable for everybody? But how do you make it affordable for those of us who are aging? And how do you make services available for those who are older accessible? Because I think really that's getting to one of the larger issues. And then one of the other big issues is, how do people get allowed to age in place? We want you to feel comfortable where you live, but we want you to age in place.
I guess I'm curious if there needs to be more of a sense of urgency around this and more of, immediacy, knowing that New York's population is getting older. I mean, the percentage of older New Yorkers is just growing, I'm not going to say exponentially, but at a really high rate. Should there be more emphasis on this from the governor's office and the administration as a whole?
Well, early 2025 is just a couple months away. We've been working on this for almost 2 years. I think it's been urgent. It's been urgent for me. I've really enjoyed working with the State Office for Aging, by the way. Very good partners with this work. So we're taking it very seriously, and as far as we're concerned, it's a very big priority. You're right. New York has a lot of people who are going to be aging in place, and a lot are going to be occupying that demographic. I plan on being one of them. I plan on staying in New York the rest of my life. But I think this is one of those things where it's like, we want to make New York a friendly place for everyone to live, but for aging New Yorkers in particular, have it make sense for you, have it be an affordable place to live.
Where are you at in penalizing some of these nursing home operators for staffing? At the end, I know that was something that was rolled out, I think, at the end of 2022 was when it was announced, and then wasn't rolled out, I guess, at that point, but that's when that came into place, and then rolled out significantly after that. I think 2023 was when that was supposed to start.
Yeah, and one of the challenges we're having there is the workforce shortages. Yeah. And when there's workforce shortage areas, which are really problematic in New York State, it's really limiting our ability to issue fines. It's something that obviously is important to us, but I think it really gets to this issue. There's a healthcare workforce shortage in New York State. Now, we've done a lot with the 1115 waiver. We have a $700 million investment encouraging people to go into healthcare, helping them get through their training in healthcare. But one of the things New York needs to be looking at is, how do we do what other states are doing to make it easier for nursing homes to actually hire more people? 37 states allow a certified medication aide to pass a medicine in a nursing home. We do that in assisted living in New York, in homes for Office of People with Developmental Disabilities, but we're not letting nursing homes do that. A lot of nursing home operators have told me that would help hiring nurses, and this is a challenge for them. One of the other things I hear when I go all over the state is, why hasn't New York joined the Interstate Nurse Licensure Compact? 41 states did that. Why is New York not embracing that? These are the things I keep hearing, and I think one of the things we have to get back to when it comes to nursing homes, we really want to make sure our nursing homes are all well staffed, but we have a workforce shortage. the Department of Health is doing what we can do. We found a lot of money, $700 million, and we're going to spend it wisely. But I think we also need others to look at what are the policy solutions? How do we move forward together?
How much is that on these nursing home organizations to make sure that they are fully staffed? I guess what can they do? And I think that's where the accountability comes into play from the state.
Yeah, that's their responsibility, but we do a lot of surveys. Right now, this is important. We are the regulator of nursing homes. We take that very seriously. You know, we're in nursing homes every single day in New York State, but it's just not lost to me that, you know, if you have a workforce shortage, it really does impede your ability to hire people that you need.
So I wanted to get to, as well, we had Greg Floyd did a report yesterday on genealogy reports and the backlog and people frustrated they haven't gotten theirs after paying for it. I guess if there is a backlog, any vision of pausing, maybe people being able to go in and pay at this point to be able to catch up? I guess where are we when it comes to that?
Yeah, I'm looking at all options. Obviously, that's one part of the department that the staffing is a challenge. We're looking at technological solutions as well. You know, and one of the things we have to own is people want to get the records from the Department of Health. Sometimes the local, community you're in, the local jurisdictions actually got the same information. It's a better place. But I'm looking at all the options right now. As the budget process unfolds, it's one of those things I'm looking to prioritize. Because one of the things I want to do is, I've been the commissioner now for almost 2 years. I'm looking at what part of the department do I need to really improve operations in? Where do I need a direct investment that really wasn't invested in during the pandemic? Because when I really look at where the investment was during the pandemic, it wasn't in vital records. And that wasn't where it needed to be. But that's one of my areas I'm focusing on right now.
How different is New York when it comes to health? I know you just mentioned it's been almost 2 years now, more than 2 years now at that. How different has it been, I guess, as a challenge for you to wrap your head around all this? Because we think about New York as such a unique state and unique challenges, and you're someone that's worked in different states, different parts of the country, different kinds of health departments, and also you've seen rural, you've seen city. How unique is New York when it comes to some of these battles and barriers?
I think we have a lot of opportunity here. I mean, one of the things about the New York State Department of Health is we're the largest health department in the United States. That may come as a surprise because we're not the largest population, but because Medicaid and New York State Health falls under the New York State Department of Health, we're the largest health department. Gives us a chance to do a lot of alignment on things. This is part of why we're so happy with the 1115 waiver. You know, $7.5 billion to do a lot of good for our people on Medicaid. Yeah. That's one thing that's an advantage for us. I think one of the things that we just have to own, though, is that we're a very diverse state. You know, when you look at New York, almost as many trees as people. We're a very rural state, and the health needs of New York are very diverse. You know, I've traveled over the state many, many times here. In 2023, I did 59 trips. In 24, I did more. And really one of the things I've seen about New York is it's hard to do across-the-board solutions for New York State. You really need to customize solutions, right? Because what I might want to do in Hamilton County, the least populated county east of the Mississippi, may not be all that effective in Manhattan, one of the most populated areas in the United States. So one of the things I really see about New York is owning its diversity, but tailoring solutions to the extent that I think makes the most sense.
Dr. McDonald, we appreciate your time. Thank you.
Thank you, Tom. Have a great day.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.